I invite you to watch this movie. Now let me take up abdominal pain. Many conditions can give rise to pain in the abdomen. Commonly worms as shown in this picture. This picture shows the adult forms of parasitic worms that produce pain in the abdomen and are usually acquired by poor hygiene. An examination of the stools will confirm the presence of adult worms and eggs like the ones shown in this picture. Worms can cause not only pain in the abdomen but also malnutrition and anemia. Worms can cause iron deficiency, anemia, and eosinophilia. Now let us consider fever, the big symptom. One of the important conditions for which we think of approaching the doctor is fever. Body temperature can be estimated with the back of your hand, but accurate determination is made by using a thermometer. Average normal temperature of the body is between 96.7 and 99 degrees Fahrenheit. If it is over 99 degrees Fahrenheit, it is called fever. The real danger of high temperature like 106 degrees Fahrenheit or 41 degrees centigrade is that brain damage can occur, especially if prolonged to 12 to 24 hours. Sometimes it may happen sooner. Placing the thermometer under the tongue is a good practice, but armpit temperature is also good enough. Any fever must come to normal within 2 to 3 weeks. Otherwise, it is considered to be a prolonged fever. Prolonged fever is fever of more than 3 weeks duration. Fever is caused by infections such as pharyngitis. Pharyngitis is inflammation of the throat, common in children, and many times associated with infection of the tonsils, that is, with tonsillitis. Now let us consider infection of the urinary bladder. High fever is a symptom of infection of the urinary bladder. The picture shows bladder, kidneys, ureter, urethra. Infection of these organs can cause high fever. High fever and chills with burning and pain while passing urine, and frequent urination with small quantities of urine each time, and sometimes with light red color of the urine, are symptoms of urinary tract infection. Infections in the body are caused by bacterial, viral, fungal, parasitic organisms. One of the important viral causes of fever is infective hepatitis due to hepatitis A virus. Pain in the right side, nausea, that is vomiting feeling or actual vomiting, loss of appetite with high fever can be due to this very dangerous illness. It can cause death if not properly treated. What is septicemia? When the infection involves and pus is formed in all organs as well as blood, then it is called septicemia. Now let us consider infection of the appendix. It is known as appendicitis. This is a picture of acute appendicitis from surgery. Why is it necessary to do emergency surgery for acute appendicitis? Because appendix is like a tube with only one end open. So when it gets infected, the opening gets blocked and pus accumulates in its cavity. Pus cannot drain out and the appendix bursts The pus spreads all over the peritoneal cavity and causes generalized peritonitis, that is, peritoneal inflammation all over. This condition is also known as acute abdomen. It requires emergency surgery to prevent serious complications such as peritonitis, septicemia, and death. Now let us consider another infection of the fallopian tube in women. Infection of the fallopian tubes in women is known as salpingitis. Salpingitis causes severe abdominal pain and fever. Another important condition in women is tubal pregnancy. Tubal pregnancy occurs in women of childbearing age, and it can produce symptoms of abdominal pain and fever. A doctor might request an ultrasound scan to detect such a condition. Unlike X-ray, abdominal ultrasound scan is harmless, but it is an expensive test because the ultrasound machine costs around 12 lakh rupees. This picture shows how ultrasound works in diagnosis. In the ultrasound, bones and muscles reflect sound waves and show up as white, while soft or hollow areas do not reflect sound waves and show up as dark. Almost all surgical procedures for abdominal conditions are now done using laparoscopy. Laparoscopy needs special equipment, and the equipment is equally expensive, but since the abdomen is not cut open, the period of hospital stay is short and recovery is faster. Infections of cuts, wounds, surgical operative sites, etc. could cause fever and pain, but tetanus is one complication that requires special attention. Tetanus bacterium is a common organism that can enter cuts, wounds, surgical sites, etc. and cause a serious condition, mortality rate of which is 1 in 3 cases. 1 in 3 cases of tetanus ends in death of the patient. Tetanus infection is very common during and after labor. What do we do to stop tetanus from attacking us? Always give first aid to wounds and cuts by first washing them and then controlling the bleeding if any, and applying antibacterial powder or ointment such as Nebasulf and covering the wound with an adhesive plaster or bandage cloth roll. Tetanus vaccine is injected in all cases of contaminated cuts and wounds. Vaccine is injected in every case of surgery and child delivery. There is another important cause for pain and fever. It is infection of the thrombus, the blood clot. The picture shows a diagrammatic vein in which a blood clot is stuck in its valves and the lumen is blocked. Infection of such a clot can produce swelling, fever, and pain, and it is called thrombophlebitis. A fragmented piece of clot is called an embolus. Here, an embolus gets stuck in an artery like the artery of the intestine, stopping blood supply to a bowel segment. The patient comes with a history of sudden onset of pain, and surgical intervention is required almost always.